حلو. الحين آخر category 3 which is the pathological one. إيش الكرايتيريا؟ any decelerations early ولا late ولا variable، بس لازم يكون في a deceleration. And also tachycardia or bradycardia, so increased in the fetal heart rate. And low variability or sinusoidal. احنا ايش قلنا هنا in the category 2 moderate variability، أما هنا we have very low variability or even sinusoidal هي this one. Okay. طيب, so what to do in a case with category 3 which is ترى هي most case that's gonna come in the ASCII، يعني دايما they bring it. So what to do لو سألتك the doctor what is your management? You either change the maternal position, most importantly, and you want to assess the maternal vitals, her temperature, her blood pressure, or the pulse, because she could be in distress. Or and also discontinue the oxytocin. ليش؟ لأنه قلنا because hypoxemia can happen due to hyperstimulation of the uterus with oxytocin. You want to initiate oxygen. You perform a vaginal examination to check for cord prolapse, rapid descent of the head, or vaginal bleeding, which is all suggestive of placental abruption. يعني احنا قلنا placental abruption can cause placental insufficiency, which is مع مين placental insufficiency with the late variability. Okay, حلو. طيب, so we're going to talk about cases that are similar to the ASCII station. Now we have 5 cases to go through that are very similar to the cases that are going to come or in the ASCII station, or تقريبا one of them صراحة is going to come. بالASCII you'll get a case with a given CTG strip and you'll be asked to answer 4 questions. First, read the CTG. Second, to determine which category the patient lies in, category 1 ولا 2 ولا 3. بعدين, what is the cause of the deceleration? إذا كانت early ولا late ولا variable. And what will be your next step in management. حلو? طيب, perfect. Let's start with case 1. We have, a 31 years old patient, gravida 2, para 1, was admitted at 41 weeks of gestation. This is post-term, صح ولا لا? She is in active labor. She received pethidine, which is an analgesic, an opioid, and Finagran earlier. The cervix is 9 centimeter dilated, so she's in labor, and her meconium stained liquor. So we want to define the risk. خلينا نمشي بالنمونيك اللي قلنا Dr. C. Bravado. So أول شيء we want to define the risk. هي إيش؟ هل هي high risk ولا low risk? She's high risk. Why? لأنه she has meconium stained liquor and she's also in labor. Okay? And she also takes an opioid because احنا قلنا one of the هذا إنه taking drugs, one of the risks. Okay? So she is high risk. بعدين we move on إيش to C اللي هي contractions. خلينا نشوف how many contractions in 10 minutes. وين قلنا contractions تحت uterine contractions. So we have هذا من هنا to هنا. This is my 10-minute span. وشي has 1, 2 contractions in 10 minutes. So حلو. Normal contractions. طيب, next we have so next we have the basal heart rate. كيف نحدد basal heart rate? We said هنا heart rate. So حطينا اللاين حقنا ولقينا إنه the basal heart rate is 150. وإحنا قلنا normal heart rate of a fetus is from 110 to 160 beats per minute. So كمان برضو normal basal heart rate. خلينا نشوف accelerations if it's present or not. Do you see any accelerations هنا? No. She doesn't have any accelerations, which is actually a bad indicator. لأنه قلنا إحنا accelerations are predictable for healthy fetus, صح؟ لأنه they predict movement. طيب, بعدين عندنا variability. We want to see if she has normal variability or a reduced one. So هنا variability we can see it is very reduced. So reduced variability. حلو. What about the deceleration? هل she has a deceleration or not? So if she had a deceleration, which type? So she has decelerations هنا contraction ونot يعني بعد uterine contraction حصلت deceleration. So this is what this is considered a late deceleration. Okay, so my patient she is a high risk patient. She has normal 2 contractions in 10 minutes. كمان normal fetal heartbeat. She doesn't have any acceleration and she has late decelerations. Okay, so which category is this? احنا قلنا late deceleration plus low variability LL, this is category 3. Okay, late decelerations are due to what? Are due to placental insufficiency. حلو. طيب in category 3 إيش قلنا إحنا فوق? We talked about what to do in this case. Due to a placental insufficiency, we want to deliver now immediately. Do not wait for the vaginal or instrumental delivery. ليش we don't want to perform an instrumental delivery? أولا لأنه she is not dilated. She's only 9 centimeter. يعني she's not fully dilated, so she's not ready, and we don't want to wait for vaginal delivery. So a requirement for instrumental delivery is a fully dilated cervix, which is not present in our patient. So we want to perform an immediate C-section to save the baby, تمام? And the mom.